Hi everyone. In today's video, we're going to talk about how you can improve your sexual performance. Coming up. Hi everyone. This is Ernesto from Attaboy Cowboy, and on this channel, we give you health and wealth tips to help you be more successful. Now in today's video, I'm going to talk about how to improve your sexual performance. Now this is one of the most important questions I get in the clinic from patients. Sexual performance is important because it's kind of like a tree with roots. It affects all sorts of things in your life. It affects your general health, it affects your self-esteem, affects your self-confidence, it affects your psychological well-being. It affects your interpersonal relationships with your partner. So it's a really important aspect of your life, and it's definitely something that should not be ignored. Now, one of the most prominent things that affect sexual health in people is age-related changes. As we age, we have changes in our hormones. And those hormones are one of the main factors that affect sexual health. Now, overall, I like to consider sexual health as a bellwether for someone's health. So if I see someone that's having sexual performance problems, whether it's a man or a woman, I can already tell they're probably going to have some type of health problems, generally relating to circulatory problems. Other issues that affect sexual performance in men and women are anxiety, stress, surgeries, exposure to chemicals or toxins in the environment like pesticides or plastics, or using a lot of cleaners in your house that have chemicals in them, or eating off plastic bowls and dishes, things like that I've covered in other videos. All of those factors are going to affect circulation in men and women. Decreased circulation is going to cause decreased sexual performance in men and women. Now, other issues that can affect your sexual performance that are easily controlled are drinking alcohol, smoking cigarettes, marijuana, illegal or legal drugs, eating a poor diet, not exercising. And the common factor in all of those things is that they all cause decreased circulation in your body. So if you think about the penis or the woman's vagina, basically as you become aroused, blood flow increases to the region and it causes erection. In a man, it causes a penis to become erect, and in a female, it causes a vagina to swell. And a decrease and that ability to circulate blood to the area is going to cause a decrease in your sexual performance and your ability to enjoy sex. Now, two of the most important hormones that affect sexual performance in men and women are testosterone and estrogen. In both men and women, those are going to control your muscles. And the more muscles you have, the more circulation your body has to have, because it has to circulate oxygen and food to feed all that tissue. The less muscle you have, the less blood's going to be circulating through your body. It's just the way it works. So the more that you're able to exercise, the better circulation, generally speaking, you're going to have, and the better sexual performance you're going to have. Now, what are some of the best exercises you can do to improve your sexual performance? Well, the number one, hands down, favorite of mine is swimming. There's nothing like swimming for improving sexual performance in men and women. Swimming has multiple benefits, because if you think about it, when you're underwater and you're swimming, you're doing exercise, and as your head is going in and out of the water, that you're not going to be breathing at certain points. So what that causes is for you to have to hold your breath and then breathe, hold your breath and then breathe. And additionally, you have that water pressure on your body. It's 8.25 pounds of pressure per gallon on your body. So if you're in a pool with thousands of gallons, you can imagine the pressure. So think about trying to breathe while there's pressure in your chest. Your body's going to have to work harder. Your muscles are going to work harder, and your lungs are going to work harder. So you're going to increase your cardiovascular strength much faster being underwater. It's similar to when you hear about boxers who like to go to high altitude for training. They'll go to Lake Arrowhead, California. They'll go to Mexico City. They'll stay there for a few months to train for a fight. The reason being is that the air is thinner. So when the air is thinner, your body has to work more efficiently with the little oxygen it's receiving to function at a higher performance. So basically, when you go back down to sea level, your body's used to working with less oxygen. So when it has more oxygen, it's a lot more effective. You have a lot more endurance and you're able to last longer during fights. Well, the same thing happens to your sexual performance. In fact, if you want to improve your sexual performance, you can go hang out in Quito, Ecuador, or in the Andes or the Himalayas or somewhere like that for a few months. It'll definitely increase your sexual performance. But for most of us that can't do that, swimming is an easy solution. It gives you two steps. Like I said, you get the exercise, and 2, there's that pressure from the water. And actually 3, you have to hold your breath while you're still doing aerobic exercise. So it's causing you to build up your cardiovascular strength much faster. The second exercise I like for men and women are Kegel exercises. Now these are really simple. Now you think about your pelvic area here. You want oxygen to flow to that area, and you want blood to get there to bring nutrients. So obviously you want more muscles there. But most of the time when you go to the gym, you're not doing exercises for your genital area. So what you want to do is you want to make sure you're doing planks, you're doing abdominals, you're doing exercises that are going to work your pelvic floor. And one of the more concentrated exercises you can use are called Kegel exercises. These are classic. You just get a pillow like this, and you just squeeze it. Squeeze and hold with your knees. And this is great for men and women. And it's also very effective if you're having problems with incontinence, like holding your urine. If you have seepage or something like that, I'll recommend this to patients. They'll do this a few times during the day, or while they're at work, they just put a pillow under the desk and they're just kind of grinding on this like this while they're doing their work, kind of like a stress ball. And if you ever try this, you'll feel it's working all the muscles here on your inner thigh, and it's working your pelvic floor. So it's going to make that area much more muscular, which is going to increase blood flow. Also, for women, it's going to increase the strength of your vagina. So the muscle is going to get stronger, and your male partner is going to feel a tighter vagina when he has sex with you. Now, one thing that I hear often from patients is, okay, I've had a lot of sex. I'll hear this from female patients, and they're wondering if their vagina gets looser when they have a lot of sex. And there's a wives' tale where people say, oh yeah, prostitutes have very loose vaginas because they have a lot of sex. Actually, it's the opposite. The vagina is a muscle. So the more you exercise it, the stronger it's going to get. So the more you do exercises or you have sex, the stronger your muscles going to get, and the more pleasure your partner is going to feel during intercourse. Now for women, the number one problem that women experience with sex is dryness in their vagina. They're not lubricating enough. So a couple things you can do to address that is basically just use lubricants. That's the easy way. And you want to make sure that you're doing more foreplay before sex. You want to spend more time preparing yourself so that way you'll enjoy sex more and your partner is going to enjoy sex more. As for erectile dysfunction drugs for women, there are no erectile dysfunction drugs that are approved by the FDA for women. However, I have heard and I know of some women that use Viagra, Cialis, some of those other drugs, and some women have had results with it, not all of them. So it's not recommended or suggested for women, but some women do benefit from it. So it's something that you can speak to your doctor with to maybe experiment with and see if it has an effect on you. Now, when it comes to men and erectile dysfunction, men tend to have more problems in general than women because men play a more active physical role during sex. And let me explain that. The woman's vagina gets swollen, but the man's penis has to actually go against gravity and stand up. So there's a lot more effort that goes into the man's erection than the female's erection. So men are more prone to have erectile dysfunction than women. So how does an erection happen in a man and woman? Basically, as you become aroused through foreplay and visual stimulation and talking to your partner, your brain starts to release sexual hormones. Those hormones travel down to your genital area and they stimulate your arteries to vasodilate, or to open up and allow all the blood to rush in. That blood rushing in causes the tissue to swell. In the penis, you have two types of tissue. You have the corposa cavernosum and the ectospongiosum. Those are the two primary tissues that swell up and retain blood inside the penis to cause the erection. Now the veins are slow to drain that blood so that the erection will maintain. As the sexual activity starts to decrease or you're not stimulated anymore, your brain will stop sending those sex hormones or those arousal hormones, and it'll start allowing for the blood to drain out and you'll slowly go back to normal. Therefore, there are two items you want to focus on to improve your sexual performance for men and women. You want to improve your testosterone and improve your circulation, because both of those are going to affect sexual performance in men and women. Now, some of the ED drugs or erectile dysfunction drugs that men use are Viagra, which is also called sildenafil or Cialis, or some of these other drugs can be very effective. The only problem with those drugs, and the reason I don't particularly like those drugs, is that a lot of younger men are starting to take those drugs and they don't necessarily need them. The problem is that a lot of young people don't eat well or they don't exercise, so they have general health problems. So they tend to be the people that take these types of drugs, and they cause vasodilation. They basically cause blood to rush through your body really fast. If you've ever taken Viagra, your skin will get really hot, and sometimes you'll get headaches because that increased blood flow. Well, if you're already having circulatory problems because you have high cholesterol, or you have heart problems, you have diabetes, you have some of these other things, that's not going to be good. It's going to cause you problems. Now, there's no research to show this, but in my 20 years of practice since Viagra came out, I've seen a huge boost in patients, young patients, 20s, 30s, 40s, coming into the hospital with heart attacks and strokes. Now, that's very uncommon for people in that age group to have those types of problems. And oftentimes when I talk to people, I believe their symptoms are related to Viagra or sildenafil or Cialis or one of those other drugs. So I think you need to be careful with those. I generally do not recommend those drugs for people. And there's also other drugs that are not listed as side effects, but that doctors do see with patients. One of the most common problems I see are floaters. I've seen patients that come in and they see things floating in their visual field. And that's something that you normally see with people that have diabetes, where they have the diabetes is causing damage to their optic nerve, and it'll cause holes in their optic field. They're kind of like black spots where they can't see anything. So they have to look around to actually see something because it's like a spot. They can't see anything. Well, people that take Viagra have those same problems, because Viagra doesn't just cause vasodilation or the opening or widening of veins and arteries and big ones in your body, it causes to all of them. So in your eyes, you have micro arteries, which are really tiny ones. It causes all those to start vasodilating, and a lot of times you'll see them burst. In fact, a lot of times when people take Viagra, they'll get bloody eyes. And those bloody eyes tend to really freak patients out. So they'll come in, they'll say, hey, you know what, doc, I was using some Viagra, and look at my eye, it's all bloody, it's bloodshot, and they're freaked out. And you know, a lot of times drugs may be safe at the moment, But 5-10 years from now, some studies will come out and they'll say, hey, you know what? We're going to take this off the shelves. This is bad. It's causing a lot of problems. Now, obviously, it's a boom for pharmaceutical companies. They're making a lot of money. Eli Lilly's making a killing on Viagra. So they want it to stay on the shelf as long as they can so they can make a lot of money off it. But those are just concerns that I have on things that I see with patients where I would recommend people avoid it. I think if you're having erectile dysfunction problems, you need to look at your general health and address your issues with exercise, eating, and dealing with some of the health problems you have. Now, let me give you some natural ways to address erectile dysfunction for men and women. Now, obviously, the number one thing is exercise. Get your body in better shape. Like I mentioned before, sexual health is a bellwether for general health. So if you have good health, you're going to have good sexual health. I've had patients that are marathon runners or triathletes or something like that, and they've reported being able to have sex for 3-4 hours at a time with their partner, men and women. So obviously you don't have to become a marathon runner, but if you're able to do 30 minutes, an hour a day of exercise, you're going to improve your sexual performance significantly, regardless of age. Again, all these recommendations are for all ages. They're going to improve your sexual performance. I see people with sexual performance problems that are 19 years old and 80 years old, and it's the same problems, circulatory problems. Now, the first supplement I want to recommend is magnesium. In fact, I like magnesium citrate better. Magnesium citrate is deficient in 80% of people, and magnesium is really hard to get in your diet. You get it in things like Brazil nuts, and not very many people eat Brazil nuts, or pork organs. You know, and I'm a vegetarian, so I don't eat pork organs. So magnesium is hard to get in the diet. Like I mentioned, 80% of people are deficient in it. So what magnesium does is it does not allow testosterone to stick to your blood. It actually causes it to stay in your bloodstream longer. So it'll boost up your sex drive and increase your libido. I would recommend taking magnesium on a daily basis, and if you know you're going to engage in sexual intercourse in the next few hours, take an extra dose of magnesium. It's not going to hurt you, but it's going to boost your magnesium levels so that you're ready for intercourse. The second thing you want to do is make sure you're well hydrated. If you're dehydrated, your blood pressure is going to be low, your blood's not going to be circulating well, it's going to cause issues with sexual performance. So something as simple as just drinking lots of water before, after, and the day of sex, and every day actually to improve your general health, is going to be very important for increasing your sexual performance. I'm not talking about soda, I'm not talking about coffee or tea or any of that. I'm talking about water. Just drink lots of water, stay well hydrated. In fact, as a general rule, I tell people when you wake up in the morning, you should drink 3 to 4 glasses on an empty stomach just to flush out your system and to rehydrate your body. Because when you're breathing throughout the night, there's moisture leaving your mouth. So 90% of people wake up in the morning dehydrated. So you want to make sure you rehydrate yourself first thing in the morning. The third recommendation is zinc. Now, for years, I've heard of people saying, hey, I'm going to have sex with my girlfriend this weekend. I'm going to buy some oysters. Or, hey, let's go out and get some oysters for sex or whatever. And I used to wonder if that was true. And in fact, there is some truth to it because most people are deficient in zinc. And oysters are high in zinc. Now, do you have to go out and eat oysters? No, you don't. In fact, there's better ways to get zinc. Buy some zinc supplements and take the RDA recommended amount of zinc per day. That's going to boost your sexual performance significantly. Studies have shown that about 40 milligrams of zinc a day will help boost your testosterone levels in men and women. So zinc is going to, again, it's going to boost your sexual performance significantly. I would take it every day, and again, a few hours before sex, instead of popping a Viagra, take a zinc pill. The next 2 supplements I recommend are herbs. Now, again, sex is all about circulation, improving your circulation. So the first one is called maca root. It's a root that comes from the Andes, and it helps with erectile dysfunction. It helps increase circulation. It's a vasodilator. It also helps boost libido and your testosterone levels. So maca root is really good for your body. You can take a little bit every day. You can use it for cooking. In fact, you can look up recipes. The Peruvians use it for baking and some of their dishes. But if you don't want to use it for cooking, you could just take a half teaspoon every morning of ground maca root. And again, you can take it a few hours before intercourse to help boost your performance. The second herb I recommend is called horny goatweed. Again, horny goatweed is a vasodilator. So it's going to increase your circulation. And I tell patients to save that herb and just take it when you're going to have sex. Take it a few hours before to help increase your circulation and increase your performance. In fact, you may notice when you take maca root or horny goatweed, your skin's going to get warm, and that's okay. That's because all your blood vessels are opening up and the blood is rushing through your body. So you're going to feel more heat on your body. Your cheeks may even get kind of flushed, and that's okay. If you've ever tried Viagra, you're going to feel the same symptoms. But Viagra is going to be 10 times more, and with that 10 times more come the added dangers. So try these natural alternatives to try to boost your vasodilation for increased sex. Now, one of my secrets to increase sexual performance, and something I've had a lot of success with patients, is I'll recommend men or women take a glass of green tea or coffee before sex, maybe an hour before. The caffeine, again, is going to cause vasodilation. So it's going to increase your sexual performance. It's going to cause anti-aging benefits. But you have to be careful. Make sure you don't add any milk or sugar to the coffee, because that's going to negate some of the effects. It's going to actually decrease your sexual performance. So in general, I like green tea because the caffeine is going to give you an energy boost. So you're going to be able to last more during sex. It's going to increase your endurance, and you're going to find you're going to have better performance during sexual activity. Now, as far as foods you should eat to prepare yourself for sex, well, you want to make sure you're eating lots of fruits. Fruits have lots of vitamin C, and vitamin C helps with sexual performance. In addition with that, it has sugar in it. Now, you don't want sugar from Kit Kats and Snickers bars and all that kind of stuff. That's bad for you. That's going to decrease your sexual performance. In fact, sugar causes decreased testosterone levels. So another reason you need sugar is because if you look at a mixture of semen, it has fructose in it, which is a type of sugar. The sperm cells use that sugar to fuel their journey up the fallopian tubes to reach the female egg. That causes impregnation. As for women need glucose to produce lubricant, vaginal lubricant, during intercourse. As you can see, sugar is important to men and women during intercourse. That's why oftentimes after intercourse, it's normal for you to feel hungry. And a lot of times people want to go eat. It's because you just discharged a lot of the glucose and the fructose out of your bloodstream, and you're going to feel hungry. So some of the top foods that you want to consider in terms of fruits to help with your sexual intercourse and also for your general health is you want to consider eating berries, citrus fruits, grapes, cocoa powder, like dark chocolates that are low in sugar, and one of my favorites, hot peppers, especially capsicum or red chili flakes. Whenever you eat chilies like jalapenos or habaneros or taco sauce or whatever, any of that stuff, that's going to help because it's going to help increase vasodilation in your body. Sometimes when you eat hot chili, you might feel your skin getting kind of flushed. That's because it causes your blood vessels to open up. That's really good for increasing your circulation and again for erectile dysfunction and for intercourse. So definitely consider adding chili to your diet. I didn't grow up eating chili in my household, but as an adult, as I read about chili and all the fabulous benefits it has, I slowly started integrating it into my diet. And now I can eat chilies and I can't really tell if the food has chili or not. In fact, I can eat a jalapeno chili and I'm not sure if it's spicy or not. I need someone else to tell me, wow, that thing is hot, because After a while, you get desensitized. You won't even feel it anymore. And chili is really good for dementia, boosting your brain power, decreasing your risk of heart attacks and strokes. It has a lot of health benefits. So if it's something that you're not eating on a regular basis, you might want to try integrating chilies and hot peppers into your diet. It's very, very beneficial. Okay, now one of the last things I want to talk about is nitric oxide. Now, nitric oxide is a gas that's really important to the human body. We produce it throughout the day in low doses whenever you take a deep breath, like that's why doing breathing exercises and doing yoga and doing activities like that, Pilates, where you're practicing your breathing, it's really good because you produce more nitric oxide. Nitric oxide is produced in your body when your lungs expand all the way to their capacity. And it's a vasodilator and it's great for anti-aging. So one of the ways you can help build up nitric oxide in your body is by eating beets, also known as sugar beets, like those red slices you put in your salad. You want to try to integrate that into your diet because it's really good for producing nitric oxide in your body, and you're going to get the anti-aging benefits and the benefits to your sex life. Now, if you're able to drink beet juice, that's becoming more and more popular now. People are buying bags of beets and they make their own beet juice. Drinking beet juice is a highly concentrated way to build up your nitric oxide. In fact, if you can drink beet juice an hour or two before intercourse, you should notice a significant increase in your performance. Now, today's video was focused on improving your sexual performance, but really I could have also called it improving your circulatory system. A lot of the recommendations today are going to have a significant impact on improving your sex life, but in general, it's going to improve your overall health. So again, if you think about improving your sex life or you're having problems with your sex life, think about what else you can do to improve your health. The healthier you are, the easier your sex life is going to be and the more fruitful it's going to be for you and your partner. Thank you again for listening. If you have any questions, please comment below. Thank you.